Hi, I'm going to be talking today about my top 5 strategies to help you support mums with the early days bowel movements postpartum. Before we start though, take a moment to hit subscribe, which really does help to support the channel and make sure that you are kept up to date with all our video content. My name's Sarahjane West Watson. I'm owner of fitfannyadams, where we are all about helping restore women's cores and pelvic floors through effective exercise. In previous videos, we've spoken a little bit about birth trauma and how that might affect a mum postpartum. Today specifically, we're looking at the return to bowel function, which can be really intimidating and can be uncomfortable for a lot of women, particularly if they've experienced perineal trauma or C-section. So here are my top 5 strategies to help support new mums. Number 1. That's really about helping women to reduce the stress that they're feeling. Reducing that anxiety will help that tension in the body, and that's really important to help soften and open those orifices, the anal sphincter. If we're holding our tension tight and if we're anxious about going to the toilet, then that anxiety will be held within the anal sphincter and it will become more difficult and more challenging to have a bowel movement. So really trying to encourage the woman to be calmer and almost to apply that birthing breath. So that's concept of softening and opening the back passage and allowing the woman to tune in to her own movements, that internal peristalsis of the matter descending rather than her forcing and pushing. So number 1, really helping to reduce that stress and anxiety mentally around going to the toilet. Number 2, we're looking at positioning. So it's really interesting when we look at the position and at the actual anatomy of the rectum, we have this lovely kink at the bottom of the rectum, which is there to assist to keep matter in, as well as our sphincters and our muscles. What happens and how this is created is we have a ligament that comes from the front of the pubic bone, from the front of the pelvis, and kind of lassos around the back of the rectum, and that helps literally keep that bend in. When we go for a bowel movement, we want this bend to be as removed as possible, so we're passing matter vertically rather than round a bend. In our modern day toilets, then often what happens is the bend in our knees keeps this kink in the rectum. So what I really encourage any woman, but particularly postpartum and particularly if there's hemorrhoids and piles involved, is for you to elevate and support the elevation of the knees above the hips. A great and simple way to do this is with a toilet roll under each foot. You can get a squatty potty, a toddler step, a little step, a small bin, anything in the bathroom that then allows those knees to be lifted. Coming into a forward incline also helps. So having those knees elevated, the feet elevated, and allowing that chest to come forwards almost so that the forearms are resting on the knees. It really allows and supports that concept of softening and opening from tip number 1. So tip number 3, and this is really looking at mum's hydration and nourishment in those days postpartum to support the bowel function, to support the digestive function. So making sure she's really well hydrated, making sure that she's got a diverse fibre-rich diet, and making sure she's not having foods which she might be intolerant to and exacerbating any issues of constipation. Some people often also reach out to their medical professional, their GP, their health visitor or their midwife and see whether or not a low-level laxative is required in the short term. Again, it's really important to reinforce that there should be a very short-term intervention just to facilitate those early days bowel movements if it is deemed appropriate. So we come on to number 4, tip number 4. This is really pertinent for those women where there might have been perineal trauma or caesarean section and there is abdominal scarring. In these instances, it's really common for mum to feel very vulnerable around applying pressure, which often happens when we are having a bowel movement, to those areas. So 2 tips are, for perineal trauma, is actually for a small clean towel, damp compress, to be applied at the front of the perineum to support that bowel movement. where there's been a C-section happen and abdominal scarring, it's also really important that mum might have a rolled up towel or a cushion, a pillow, just to apply on her tummy to give a little bit of support and bracing as she's having the bowel movement. So again, just making sure that one is to hand in the bathroom is really, really helpful. Let's move on to the final tip, number 5. And this is really about supporting the back passage and the muscles around the back passage of the pelvic floor after a bowel movement, which can be so helpful in restoring that tissue because we're getting the blood and the nutrients and the removal of waste to the area that might have been damaged. So to support and encourage mum to close the anal sphincter and to do some rectal lifts internally after she's had a bowel movement. So to close that sphincter and lift internally, making sure always at the end of doing that little exercise, she just softens and releases everything. And that's a lovely way of really supporting that internal tissue and nourishing our tissues from the inside. So there we have my 5 top tips for helping mums with the early days bowel movements. At Babyem, we're passionate about empowering new parents and provide you the support to help them. If you've enjoyed this video, please take a moment to hit like and to subscribe, as it really does help this channel and it means that you will be kept up to date with any new video content. Thank you.